simulation-based exploration of the anterior drawer test in juvenile patient populations. The orthometers have been used in many experimental and clinical settings to evaluate the structural integrity of the ACL. What this device essentially does is that it performs the anterior drawer test, and you can measure in millimeters how much laxity there is in the anterior cruciate ligament. The purpose of this experiment was to establish baseline specimen-specific juvenile knee models that can accurately predict the anterior drawer test. In doing so, we will analyze the degree of displacement for each model when subject to different anterior loads. In doing so, the established experimental data will be used to compare the anterior tibial translations that were measured using our finite element representations. FEBio software suite was used to develop the finite element representations of the pediatric knee joints. The protocol established by the Open Knee User's Guides was used to follow and create the finite element representation models that were utilized in this experiment. To replicate the anterior drawer test, the femur was fixed in all degrees of freedom, whereas the tibia and fibula were fixed in all degrees of freedom except the y-axis to allow for anterior-posterior translation. Anterior directed forces of 67, 89, and 133 newtons were applied to the tibia and fibula, and simulations were run at 30 degrees of flexion. In total, 22 pediatric knee models were utilized for this experiment. Here is a graph that shows the measured anterior tibial translation for each force. The dashed lines represents the simulated anterior drawer tests that were performed using FEBio compared to data that was established experimentally in the literature. Table 1 and Figure 5 show the descriptive statistics of the experimental versus the simulated anterior tibial translation, in addition to the 95% confidence intervals that were performed in order to compare the experimental versus simulated data ranges. From the 95% confidence intervals, it can be observed that simulations run at 67 and 89 newtons produced intervals that interlapped with the experimental data. It is worth noting that there is a wide degree of variability in terms of defining anterior tibial displacement at each force level, which has been established experimentally. This is because there are many factors that can determine how much ligament laxity an individual has, such as age, sex, and muscle imbalances. Furthermore, it can be observed that FEBio is able to replicate data that has been measured experimentally, except when subject to 133 newtons at 30 degrees of flexion. This in part can be due to natural physiological barriers such as the tension of the skin, quadriceps, and hamstrings, which are not included in this study and have been shown to impact anterior tibial translation. Nevertheless, we were able to develop computational pediatric knee models that can accurately predict and replicate the anterior drawer test, which further demonstrates the validity of these knee models and provides a solid foundation for further experimental studies. Thank you.